Okay, well, hi everyone. This is Steve Troutner coming to you live from Miami Beach today. Want to thank you, first of all, for taking time out of your busy day today to invest in yourself and in your business. It's very important that we do this periodically. And we try to hold about 3 of these events a week, sometimes more, sometimes less. I know it's tough to stop selling, stop marketing, and try to get ahead, but always need to be looking down the path to make sure that you are set for the next week, the next month, the next year. This is actually the time of year when you should all be taking stock of the carriers you are currently aligned with. Be sure you have all the contracts and state appointments that you're going to need, and begin to outline the course you plan to take for assisting your clients throughout AEP and OEP, which, as you know, is right around the corner. If you're selling Medicare Advantage plans, don't forget to complete your AHIP and carrier certifications and your FFM certification if you're selling ACA plans. As you consider how best to optimize coverage for your clients this season, you're going to want to think about ways to ensure that they're really getting the best type of coverage that ideally fits their lifestyle. You can expect to frequently come across prospects who simply either can't or prefer not to go into a doctor's office every time they're feeling a little under the weather, less than 100%, whether it's flu symptoms, their child's runny nose, a skin rash, or even the onset of anxiety, depression, or other behavioral health concerns. These are classic opportunities where a telehealth plan squarely fits as the perfect solution for many of your clients as a supplement to their core health plan. I am an ardent believer that everyone should have access to comprehensive telemedicine benefits, both for convenience as well as for prudence. That's why we now offer 2 novel telemedicine programs to give you options to place the best telemedicine plan with the right customer. So today, I am pleased and honored to welcome back my friend, J.R. Jordan, to explain how telemedicine fits within a portfolio of health products for our clients, and to specifically illustrate the benefits of his exclusive 24/7 virtual medical program called AkosDirect. If you have any questions throughout this presentation, please enter them in the Q&A window, and we'll do our best to leave time at the end to answer them all. If you're not already contracted to sell AkosDirect or any other carrier that you still need, please contact us at the email address or phone number on the screen. Hi, JR. Thanks for joining us today. Can you introduce yourself? Tell us why we should be talking about telemedicine with our clients and what's so amazing about AkosDirect in particular. And I'll stop sharing it and give you total control of the presentation.
Fantastic. And thank you so much, sir. It's great to be on. Thank you for allowing me to be a part of this presentation and show you AkosDirect and the truly revolutionary program that AkosDirect is. And I'll start by saying this. Well, I'll introduce myself. I'm 3rd generation in the insurance industry. So I was born into it. Actually been in the insurance industry now for over 25 years, which I love insurance. I think insurance is absolutely fantastic. It is my passion. I like helping people. That's what that I want to do. And COVID taught us a couple things. COVID taught us, number one, telemedicine is really cool. We want more of this. So it was expanded actually into a more robust virtual medicine offering that has been approved in all 50 states. And I always like to joke that it taught us that we can use QR codes as well. So I can get into the program straight away, Steve, if that's works for you, sir. And
yeah, please.
I am sharing my screen right now. So can you all see it?
We sure can.
Fantastic. So, ladies and gentlemen, to set the stage and manage expectation, which I'm a huge believer in, I'm going to go ahead and let you know in this presentation, I'm going to go over a deck I am going to go over the sales site that you'll each get. It is so darn easy. I'm going to go over a sample provider booklet, and then I'm going to show you the website where you can actually look up prescriptions, providers, and a whole bunch of other cool stuff. So again, my name is J.R. Jordan. I'm honored to be here with you today. AkosDirect is a product and a program that you can actually sell to every single prospect. Everyone needs this program, and at the price points, it's absolutely fantastic. I own the program on myself. I believe that if you believe in something, you should own it on yourself and you should utilize it. So actually, one of the screens that I'm going to show you today is my app for AkosDirect. So I'll jump right into it. And the reason why we have AkosDirect, which is a virtual direct medicine program, virtual direct doctor, it's your very own doctor and care navigation team. The reason why we developed this program is because for so many, the healthcare system is truly broken. The rising cost of health plans from 2012 to 2020, the average premium on individual health plans has risen over 43%, ladies and gentlemen. And if you look at group health plans, it's risen over 54%. And the reduction in benefits, we're seeing higher deductibles and limited networks. I have folks, friends, and family that stop into my offices and say, hey, JR, can you take a look what I have here? And I look at some of their deductibles and some of their out-of-pocket maximums, and wow, pretty darn high is the standard these days. Access to quality care is few and far between. Members are unable to find care, and convenient options seem to have just all closed down. Ladies and gentlemen, try to make an appointment with your primary care physician in person and see how long it's going to take you. I would love to see my doctor in real time, right over my phone or my tablet or my laptop or my home computer, and get treated, get diagnosed, talk to a care navigation team that has the ability to call in prescriptions and really take care of me. This is a team that knows me, knows my health history, knows my family, knows my name, because it truly is my primary care physician. And that's what AkosDirect does. Right now, ladies and gentlemen, what we're doing is we're reducing benefits to further control costs. We're switching carriers and networks year over year. Every open enrollment, we have to do it for our clients. And we're oscillating between ACA, STM, health share, limited medical every year just to make sure we fit into their budget while we're trying to protect them. And it's really hard when somebody has a super low budget but wants a lot of protection. And there's a lot of folks out there that just want access to a doctor. They want health care. There's also a lot of ways you can save your clients money utilizing AkosDirect by coupling it with medical plans without adding the first dollar coverage. And I'll get to that in a moment. So right now, again, for many, our system is broken. AkosDirect is really changing the way individual health plans are sold. This is my, it's a screenshot of my app. That's me right there. And I can start a virtual urgent care visit in real time. Ladies and gentlemen, this is literally bringing back the house call. In real time, I can start a virtual urgent care visit and see my primary care physician. If they're not available, there will be another physician that I see. I can chat with my care navigation team in real time. I can schedule appointments, including mental health appointments, because this has mental health coverage. I can do health risk assessments to give that care navigation team and primary care physician a better understanding of who I am, my health, and my needs. I can talk to that care team. I can order medications because, ladies and gentlemen, not only are medications included in our program at no cost, but they're delivered to your door at no cost. I can store all of my medical records right here and vitals and all that good stuff on a program that's guaranteed acceptance, covers pre-X, is available in all 50 states for both under or over 65, simplified pricing that you can memorize with next day effective dates. It is a cutting edge platform, and ladies and gentlemen, more and more people are becoming tech savvy. I was just on a call prior to this with some good friends and some people that we do business with regarding RPM, remote patient monitoring in nursing homes and senior living. And everybody's talking about how, you know, they're utilizing the latest technology in those nursing home and senior living, and the people in there can utilize it super easy. So again, for those of you that know how to use apps on your Android or on your iOS, we have this amazing platform with white glove care navigation, scheduling assistance, access to our entire network, you know, delivery of meds. And again, talk to your doctor or care navigation team 24/7 whenever you want, no copays. Your doctor, because it is your primary care physician. I'll actually show you a sample provider booklet here in a couple minutes. So I do a lot of repetition. I believe in it. No copays or charges. They will do service referrals all day long, even maternity service referrals, because lab imaging and x-ray network is included in this. There's RX delivery and coverage. There is no prolonged wait. AkosDirect is not health insurance, it's health care. And ladies and gentlemen, when you separate healthcare from health insurance, you give your client a better, higher quality experience that leads to faster diagnosis and a whole bunch of other health advantages for your clients. In addition to that, low cost. When you add AkosDirect to a program, you're able to lower the cost. And I'll discuss that with regards to ACA and STM here in a moment. Now, here's a little bit of a price comparison, and it's kind of low as far as the health insurance premiums are right there. If you look at our program, we have 24/7 virtual care, the prescriptions, there's no copays. It's all at a capitated rate. There is no balance billing, unlimited visits, free medications, mental health services. For an individual, it's $79 a month, ladies and gentlemen. I mean, that's super duper affordable. For a couple, it is $110 a month. And with a family, it is $125 a month. Ladies and gentlemen, this is all virtual. So except for the lab imaging and x-ray, and we have a network across the country with Quest, Sonora, a whole bunch of other facilities. But so many things are just virtual these days, and the care you receive is top notch. On this, for an individual, there's actually 2 prescriptions delivered every month included in that price. For a couple, there's 4 prescriptions included. And for a family, there's 5 prescriptions included. And I'll show you a look at our formulary in a moment, how to search it. Just to let you know, we have over 440 prescriptions on our formulary in over 980 combinations or formulations, if you will. So our formulary is expansive. Our price on this program is super duper affordable. Ladies and gentlemen, I live in the state of Arizona. Buddy of mine I've known since middle school comes into my office, lets me know he's leaving his job, and he wants to look at medical insurance. I went through Health Sherpa, showed him, he wanted himself, his wife, and his 4 kids, wanted first dollar coverage. and the medical plan was going to be around $3,200 for him and his family on the Affordable Care Act, which to me, that's not affordable. $3,200 is not affordable. We took out the first dollar coverage on the Affordable Care Act. It dropped the premium all the way down to $1,400, I believe. So an $1,800 savings. You add in AkosDirect for the entire family for $125. Now that family has prescriptions. They have, yes, you can go to your current doctor and AkosDirect, but AkosDirect, we're going to, all of these services are included with AkosDirect. Our lab imaging and x-ray program, ladies and gentlemen, our sample rates on the right, take a look. They can vary by location, so please understand that. But with our lab program, it's discounted pricing, and you know what the price is before you go. Okay? You're going to be protected from unexpected bills or rate changes. And because this is doctor-to-doctor referrals, physician to physician, we're normally able to get you an appointment within 2 hours from the time you make the request. I mean, we are very good at this, ladies and gentlemen. The advantages of the AkosMD imaging program, again, priority scheduling. The centers are prohibited from upcharging, and these centers are not allowed to unbundle codes, because that's what really gets you in the end. You're protected from frivolous charges. You can do medical necessity reviews. And again, we do these referrals back and forth. And Lori, I see your open questions, so I'll go ahead and answer those here shortly. Let's take a look at the state availability. For both labs and imaging, we have all of these blue states where we can offer discounts. Labs are only in those 4 states. We can refer them for imaging, or these 6 states. We can refer them for imaging in these 6 states, but it's just not on a discount program because it's hard to get into a discount program in those 6 states. Behavioral health services. Everybody's talking about them. Everybody's asking about them. Ladies and gentlemen, we offer them. They are included. They have a dedicated AkosMD Care Navigator that is going to help guide that patient to the appropriate services. They'll schedule the initial appointment. They'll help with any follow-up appointments. They make sure that that patient has a good understanding of the treatment plan and is compliant. Ladies and gentlemen, our appointments with the counselors are available 7 a.m. to 10 p.m., 7 days a week. And yes, the patients may request the same counselor for subsequent visits. On top of that, if there's crisis calls that are outside of the hours that our counselors are available, we have trained behavioral health registered nurses standing by to help. Depression, stress, anxiety, eating disorders, grief, family, relationship issues. Ladies and gentlemen, the first 4 are covered. So your initial consultation and evaluation by the psychiatrist, and then 3 visits included for therapy after that. So that's 4 that are included at no cost. And then if they need additional visits, it shows you what the cost is right there. For additional psychiatry visits, it's $175, and for additional therapy visits, it is $115. And this for everybody in the family that's on the plan. So if you have an individual, they have 4. If you have a spouse and spouse, they each have 4 visits. You have a family, family of 5, there's 20 visits right there. Look at that value. I mean, this plan has so much value built into it that it's pretty darn amazing. There's a 10-day free look period. It's guaranteed acceptance or issue. 18 years of age for single dependents, from 6 months to 26 years of age. So yes, anonymous, they will opt out at 26. There is no U.S. residency required. there is no social security number required. No worries, no apologies. We're here to try to at least have some fun or smile. We do accept Visa, MasterCard, and ACH. Enrollment is super easy. I'm not going to show you this enrollment. What I want to show you is this, because I love it. This is the site that you would get. Each one of you would get one of these sites when you sign up. So the contracting takes about 60 seconds, and it's online. And then once you do that, you actually get your very own sales site, back office. It will have your logo right here, okay? It will have your information right here. I'm using my friend Dave's right now. You're able to manage your back office. You're able to sign up additional agents. You're able to put information about your company right here. What I love about this, ladies and gentlemen, is you can hit info right here and information on the product, but there's a rad video right here. It's 2 minutes long. You can send this out to your clients. It really goes over the product a lot better than I can. You have your FAQs. You know, what is virtual primary care? What kind of healthcare services are available? How much does it cost? Who's Lighten? Because Lighten RX is the prescription component of the program. They're the ones that make sure that those prescriptions are delivered same day in some cases, but usually within 24 hours, delivered right to your door. No additional cost. Who would deliver them? Do you need insurance? You don't need it, but obviously we'd love everybody to have insurance. There's some additional membership benefits because it's part of association, but I really don't go over those. Pricing's right here. If you want to download a brochure, you can. If you want to enroll, ladies and gentlemen, this is the easiest. This is being recorded, so I'm not going to do it like I normally do because then it's going to capture all my information. But if you hit continue, first name, all that, easy peasy. Just fills it right out. Then you put in the payment method, check the box, and then you can have the client sign via cell phone or email. They sign it, you submit it. It's really, really easy, ladies and gentlemen. But this one site, let's call it the one hub. This one site is everything that you need. It is your sales site. It is your submission site. It is your back office where you can see all of the membership holders of the AkosDirect program, brochures, videos, you name it, right here. Just pretty darn rad. In addition to that, I do have, let's see here, a sample provider booklet. So it shows that this first doctor went to, yes, Harvard, okay, and then a doctorate at University of Michigan School of Medicine, 3 states, English. This physician does 5 states in 2 languages. This physician does probably, it looks like about a dozen states here in 4 languages. She handles 1 state in 4 languages. So this is just sample to show you it's deep. We have a lot of physicians in our program and a lot of languages are covered in our program. So really fantastic. In addition to that, ladies and gentlemen, there is a just standalone website, which is direct.akosmd.com. And you can actually search pharmacy benefits, or I can actually send you out a searchable Excel file that has every single medication on here. But one of the things I like to do is if I just type A, you'll see that Aclovar, I know I totally butchered that, is included in the subscription. So no costs, delivered right to their door. And this acetaminophen, oxycodone, is $2.42. That's their cost delivered. This one at 7.5 is $3.17 for 30 tablets delivered to their door. These three all included in the subscription. I just, just to show you all, this formulary list is far, deep, wide. It's pretty darn fantastic, ladies and gentlemen, and we're updating it constantly. So again, after you complete the contracting with AHCP, you will be able to get your very own sales site with your logo and all of your information. This will be your back office, your front office, sales and marketing, and all of that good stuff. If anybody wants a copy of the presentation, it is available for you. Provider booklet, it is available for you. Literally anything you need is available for you, ladies and gentlemen. So make sure that you just, I'll type in my email address you can use right here in that bar. jr@as1ig.com is a really easy, quick email address. Anything that you want from me, any questions that you want to ask me after the webinar, I'd love to help out. I work for all of you. I've been, friends and have the honor to work with Mr. Steve Tratner for quite a long time. I love working with AHCP and the whole organization, and I'd love to do my best to earn your business and then also help you with any and all sales, whether it's this product or it's a National General, Allstate, AHCP, whatever to help you. That's what we like to do because we want to see you succeed. I can answer some questions if you'd like. So Lori, someone can cancel at any time. So yes, they can. Very easy. In addition to that, can you still go to your current doctor in AkosDirect? You can. So I am the perfect example. I have a group medical plan through United Healthcare, and I have first dollar coverage with copays for doctor visits and all of that. But I also have the AkosDirect plan on myself and my family. And I use the AkosDirect when I want real-time messaging or want to see a doctor or speak to a doctor right away. I use AkosDirect. The utilization is a lot higher there because it's right on my phone. It's super easy. I get prescriptions delivered right to my door. But at the same time, I just used my medical insurance to go to my heart doctor. And I used my group United Healthcare plan and paid a copay with that. And that was completely separate than my AkosDirect membership. So hopefully that answered that question.
And I think I can address kind of this question. We can, because sometimes we've got agency owners and agency producers, et cetera. Not everybody earns the same commissions, but commissions are available to you if you call our 877 number there on the screen, and one of our very qualified broker service reps will be able to assist you personally with that. Did we answer all the questions then, JR?
One other question was, what hospital would the client be associated with? So I believe that's with regards to labs, imagings, and x-rays. And so we have Sonora Quest, we have Sonora Quest Diagnostics. We have all of the big ones in our network and some smaller ones to make sure we have phenomenal coverage for your clients for those labs, imaging, and x-ray referrals. With regards to virtual urgent care and your virtual primary care doctor and care navigation team, obviously those are both virtual. And with regards to your mental health coverage, that is also virtual. And we've really found that's what people want.
Mm-hmm. Jared, there's a question here about sort of coordination of care. So if the primary care refers to a specialist, for example, is there an app for the physicians to be able to share medical records and communicate with one another?
So 100%. That's a great question. I love it because that's how my brother uses it, and that's how I use it. So that's all done during onboarding to make sure that they can share medical records, and that AkosDirect can act as one source for all your medical records to be stored, and so that anything that's done with the AkosDirect doctor is passed along to whatever doctor that you designate during the onboarding process. Great question.
And Laura's also asking, how long has AKOS been around?
So AKOS has been around for, gosh, I want to say probably about 8 years. They were a part of AKOS, which was just purchased by Optum. And the group of physicians that started it own some of the largest heart hospitals and facilities here in the state of Arizona. So very, very deep company.
Excellent. Are there any other questions?
And Laura, to add on to that, because it's such a good question, they were so good at virtual workers' compensation cost mitigation that they had physicians and they had the program set up nationwide pre-COVID. So they would handle workers' comp cost mitigation. And then COVID hit, and they realized that they also had all these physicians that could help other things other than workers' cost mitigation. And so they opened out that doctors network for telehealth, and then it grew into virtual direct primary care, where these are, it's really your doctor that's going to service you.
I think in the early days of telemedicine, that's the big miss. Everybody used telemedicine for urgent care, that call at 3 a.m, or the call to your physician when you couldn't get away from the office. But in reality, 85% of the care that we need from our primary care physician is not hands-on. That means there's really no point in going to see your doctor. But that's the only way the system was set up in order for them to get that copay or the co-insurance or whatever. But with these virtual primary care networks, now we can establish a relationship with a primary care physician who knows us, knows our chronic conditions, knows our history, and we can always get on the phone with them within a couple of days or on a video call. And it's so much better than having to spend literally 3-4 hours out of your day schlepping over to the doctor's office, waiting in there, waiting to see the doctor, going back to work or going back home. I just think it's phenomenal. My family uses it as well. And I can't tell you how much time we save. So I think the virtual primary care component of this, among everything else, is probably the most valuable piece of it. Sorry, just giving my 2 cents there, JR.
Oh, no, thank you. I agree. I just absolutely love it. I use it myself. I've been using telemedicine in some way, shape, or form for 15 plus years, 20 plus years probably. And in its new iteration, this is my primary care doctor for me and my family. It's convenient, it's easy, it works 24/7, and it provides all the services that we need. And anything outside of that, we know that we need to go to probably a real, emergency room or hospital, but we use the care navigation team with AkosDirect to help us. They can tell us whether we can get it done, at home and, at the hotel we're at, or if we need to go to a ER or an urgent care or the hospital. So it's a great tool of protection to have in your pocket at a very, very low price. And you can add it on to ACA. Again, take off the first dollar coverage. You can add it on a short term, take off the first dollar coverage. You can add it into limited medical programs. You can add it into the health sharing programs. You can sell this to seniors. You can sell this to college students. It is just, the applicability is enormous.
Yep. And I think strategically that makes the most sense. If you are selling ACA plans, you could probably save a family easily $1,000 a month on their premium by increasing their deductible and sliding in this program. And they'll be so grateful for it.
Great.
Okay, I think that wraps it up for today. Thank you so much for sharing all your time with us, JR, and also for all the attendees. Thank you very much for being so punctual. We have recorded this session, so we'll make it available on the AHCP website under pre-recorded trainings, and we'll also send out a copy to everybody that registered and attended. Thank you again. Take care, everybody.
Thank you all. Have a wonderful day.